Hi, my name is Grace Besser. I'm a senior at GMC, and for my senior project I'm creating a bunch of videos that go into different topics that play into weightlifting, such as nutrition, safety, equipment. I'll also be going over the 4 core movements of weightlifting. In this particular video, I'll be detailing the anatomy and physiology of the deadlift and how to perform the deadlift. Let's get started. So there are primary and secondary muscles involved in the deadlift. I've color-coded some of the primary muscles. They're in this purple color, and the secondary muscles are in this pink color. Some of your primary muscles are going to be the quadriceps femoris, your gluteus maximus, your spinal erectors, and your hamstrings. Some of your secondary muscles are going to be your abdominals, your calves, your forearms, your latissimus dorsi, your trapezius, and your rhomboids. Your rhomboids are underneath your trapezius. They're deep to the trapezius. So let's discuss some of your secondary muscles first. One of your secondary muscles here is your forearms. They help transfer the weight as you're pulling up from on the bar. They help transfer that weight and the force, mainly the force, up to your upper back, to your trapezius. Your trapezius and your rhomboids are up here. Your rhomboids help contract your scapula, which is your shoulders, your bone back here. The trapezius also helps with good form, but it also helps it takes on the force that the forearms transfers to it, and it helps with stabilization. It helps stabilize that force. It helps keep the force so it's in a thicker and stronger muscle. Your latissimus dorsi, it helps to keep your vertebral column stable. Your vertebral column is your spine. It's also a pretty thick muscle, and it handles some of the force. Your abdominal muscles over here. Your abdominal muscles include your rectus abdominis, your transverse abdominis, your external oblique, and your internal oblique. There's several different layers right there. These also help stabilize your back. When you contract them, when you kind of suck them in, they're going to help with that force, and they're going to help stabilize your back. They're going to work together with the latissimus dorsi and your trapezius to help stabilize your vertebral column. And then finally, your calf muscles down here. They're going to help with your foot and ankle mobility. They don't really get actively worked out during a deadlift, similar to your forearms, but they are going to help with that ankle and foot mobility, which you will need when you get into position to pull the weight up. Some of your primary muscles, let's discuss some of those. So your primary muscles, they're the ones that take the brunt of the force and the weight on during a deadlift. Your quadriceps femoris are over here. There's that big, thick muscle group. They're going to help extend your knees, and your knees are going to have to be extended as you pull up so that you can get into position. It just helps overall with your strength. Your hamstrings and your gluteus maximus, they're going to help extend your hips. A lot of people make the mistake of thinking that the deadlift is just a quadricep exercise. It's not. The hips are involved as well. The hips generate a lot of power and force into the movement. Your hips and your knees are going to have to move together in a pretty fluid motion. Your spinal erectors, they're 3 thin muscles that go up and down your back. They kind of go underneath a bunch of your upper and lower back muscles. These muscles help stabilize your spine. They're the ones that work closely with the spine. The trapezius and the latissimus dorsi, they're going to help out your spinal erectors. Your spinal erectors, you want them to be as straight as you can possibly make them, barring the extreme. You don't want a severe curve in your back. That's going to lead to injury. You do not want, especially in your lower back. Your lower back is not designed to actively hold weight. It's designed to help you up. It's not designed like the quadriceps are designed. The quadriceps are thick muscles, so is the trapezius. They're designed to hold the weight. Your spinal erectors, they're thin. They're there to help your back remain straight. Let them do their job, and let the force come from your hips and your legs. Now that we have discussed some of the primary and secondary muscles involved in a deadlift, we can get into the actual deadlift. I normally place my feet around my shoulder width. The bar should be very close to your leg. It should almost touch your skin. A cue I like to use to remember where I should place my feet is I look down and I align the bar with my shoelaces. If your hands are too narrow, it can be harder to pull the bar up, since your knees might get in the way. I try to place my hands just outside of my legs. That way my hands and wrists don't rub up against my knees as I am pulling the bar up. There are two main hand grips used in the deadlift. There is the mixed grip, in which one forearm is facing outward while the other one is pointing to your body. The idea behind this grip is to secure the bar from slipping from your hands. The other commonly used grip is the hook grip. This grip is the one I personally like to use. You place your thumb under your fingers. This helps with grip security. The hook grip can be harder to maintain when the weight on the bar gets heavier. Some people don't like this grip because it can become uncomfortable. It's not uncomfortable to me, so I just supplement the grip with exercise tape to protect my thumbs from abrasion. Now you are ready to perform a deadlift. Take a deep breath at the top and bend down. Try to keep your back as straight as possible. Remember, your spinal erectors are designed to support your back, not lift a lot of weight. To prevent lower back curvature, try to imagine bending the bar. This mental cue helps me to use my upper back muscles in the deadlift. As you reach the top, puff out your chest. This may seem silly, but it's a physical cue to keep your upper back contracted. Now, lower the bar in a controlled descension. A personal problem I had during my deadlifts was my knee angle. I was setting up for the deadlift like I would a squat. Your angle in your knees should be wider than the angle for a squat. If you are using a belt, put it on as tight as you need it to be. When you take a deep breath, push your stomach into the belt. There are many different ideas of what breathing technique you should use and which is the safest one for you to use. I personally use the Valsalva maneuver. It entails you holding your breath for the hardest part of the lift. Basically, you hold your breath, push your tongue to the roof of your mouth, and try to breathe out, which creates a strong contracted core. Remember to breathe out when you are done with the rep. Do not hold your breath for more than one rep. So some people will suggest another breathing technique. For example, during a squat, you would inhale on the way down, but you would exhale on the way up. I don't use this particular breathing technique. This is because I have chosen to utilize the Valsalva maneuver. Upon analysis, I realized that the likelihood of me getting hurt was pretty low. If a person is to get hurt using the Valsalva maneuver, they most likely already have a history or a high risk for cardiovascular problems. If you are a generally healthy individual, you most likely will not get hurt using the Valsalva maneuver. In fact, it can possibly lower your injury risk. However, if you do have issues with high blood pressure or cardiovascular risks, talk to your doctor or your trainer. I'm not here to give you a bunch of rules you must follow. Your goal is to become stronger. That's all I have for y'all for this video. If you guys have any more questions, comments, concerns, you can check out the rest of my videos. Thanks for watching.